So picture the end of a really well-lived day for an adult German short-haired pointer.
Oh, that is a beautiful image right off the bat.
Right. You've had the early morning run, followed by maybe some complex scent games hidden out in the yard.
Mm-hmm.
And later on, there was a heavy retrieve session, maybe capped off with a really long swim in a local lake.
Sounds perfect.
It does.
Yeah.
And now, it is finally the evening. She's completely content, just curled up asleep with the family.
The exact essence of the breed when they're, physically and mentally fulfilled.
Exactly. From the outside looking in, like to a neighbor or friend stopping by, it just looks like a perfectly normal, happy life with a highly active dog.
Yeah, but...
Okay, let's unpack this. Because if you actually watch what a seasoned owner does after all that beautiful motion, a completely different picture emerges.
Oh, absolutely does.
The owner's hands start going over the dog's body.
Mm-hmm.
Fingers are pressing along the ribs, checking deep between the toes.
Checks.
Yeah, quick tick check, a careful look into the ears after that swim. Maybe a glance at the eyes because, she was pushing hard through some dense brush earlier.
Right, and to an outsider, that constant checking might look like, I don't know, overparenting.
Yeah, exactly. The owner is quietly noticing if she's recovering normally or if she's getting up off her bed just a tiny bit differently than usual.
But it's not paranoia at all. I mean, what you're describing is the absolute central rhythm of adult preventive care for this specific breed.
Right.
You don't protect an adult GSP by slowing the athlete down. You protect her by maintaining the athlete wisely.
Maintaining the athlete wisely. I love that. And that is the exact mission of our deep dive today.
That's a big one.
It is. We are looking at this fascinating stack of sources. We've got veterinary medical journals, breed-specific training manuals, and some really detailed owner case studies.
Some great data in there.
Yeah, and our goal is to extract the most critical insights from all these materials to figure out how to take all the pieces of her life, how she moves, eats, and trains, and pull them into a cohesive routine.
Mm-hmm.
And just a quick note before we jump in, this deep dive is for educational purposes only. If you're ever concerned about your dog's health, you should always consult your veterinarian.
Always. Absolutely. And diving into these veterinary journals, the consensus on maintaining that athletic engine starts with something that sounds incredibly basic.
But it's really not, is it?
No, it actually forms the foundation of every single medical and behavioral decision you will ever make for her. You have to know your own dog's normal.
The baseline.
Exactly.
This concept popped up in almost every single source we reviewed. Before you can maintain an engine or, spot a tiny problem with it, you have to know exactly what that engine sounds like when it is running flawlessly.
Right.
It's exactly like driving your own car. Like if you drive the same car every single day and suddenly the engine makes this tiny, barely perceptible new rattle.
You hear it instantly.
Yes, your brain flags it instantly. You know something is wrong, but a stranger sitting in the passenger seat, they wouldn't notice a thing.
They don't have the baseline. That is a brilliant analogy, and it maps perfectly onto veterinary care.
It makes so much sense.
Yeah, and if we connect this to the bigger picture, you just cannot protect a German Shorthaired Pointer from physical decline or illness if you don't know what her normal motion and behavior look like.
So we're talking about things like what exactly?
We're talking about knowing her usual appetite, her typical energy levels immediately after a heavy run, and exactly how long it usually takes her to recover.
Right.
You even need to know what her ears normally look and smell like, and what her regular sleep pattern is, and her baseline behavior when she's just hanging around the house on a normal Tuesday.
Okay, but I'm looking at this long list of things to monitor in these journals. Respiratory rates, sleep hours, stool consistency.
Yeah, it's a lot.
And I honestly have to wonder how anyone with a full-time job manages this. Like, are you literally supposed to walk around with a clipboard and a stopwatch every time the dog takes a nap?
No.
Because that sounds exhausting.
It does sound overwhelming if you view it as like a rigid chore. But the sources emphasize that this is about active awareness, not obsessive paranoia.
Okay, active awareness.
Right. It is passive data collection that you just absorb by living with her. That baseline is simply what makes small changes visible to you.
I see.
Without it, you are literally just guessing whether a slightly warm ear is an infection or if she's just been, lying in the sun.
Right, right.
And what's fascinating is how this active awareness completely transforms your regular veterinary exams. The medical case studies show that routine visits shouldn't just be dictated by a date circled on a calendar.
It should be a dynamic conversation. fueled by the specific notes you bring in.
Precisely. Notes about any ear signs you've noticed after a swim, subtle paw issues, skin changes, or slight shifts in her thirst.
Basically anything out of the ordinary.
Anything going on with her digestion, a microscopic limp, how she's tolerating the summer heat, or any behavioral quirks.
Right.
That data turns a standard 15-minute exam into a highly targeted medical consultation. Think about it. Your vet only sees your dog maybe twice a year.
Yeah, that's true.
You see her every single day. You are the ultimate expert on her baseline.
That completely shifts how I've always thought about vet visits. It's a partnership, not just an inspection.
Exactly.
So, if we establish that baseline when she's at rest, the next logical step from these training manuals is looking at the physical engine that actually keeps her moving.
Right, the body condition.
Yeah, we're talking about body condition and how she is exercised. And the breed guides make it very clear for GSP, body condition is absolutely not about cosmetics.
Not at all.
It has nothing to do with making her look sleek for an Instagram photo. It is the literal foundation of her motion.
It really is. When veterinarians evaluate body condition, and they use a specific scoring system for this, by the way, they are feeling her ribs, looking at the definition of her waist, checking the abdominal tuck, and assessing her muscle tone all at once.
Okay, so they're looking at the whole picture.
Yeah. Ideally, you're cross-referencing your own checks with your veterinarian's assessment rather than just guessing. Because sudden weight gain, weight loss, or especially muscle loss are massive red flags.
Because any extra weight directly impacts her joints, right?
Yes, heavily. Every extra pound increases the kinetic force on her wrists and knees when she comes to a hard stop in the field.
Ouch.
Right. It degrades her speed, it ruins her heat tolerance, and it directly threatens her senior mobility down the line.
Which means we have to look really closely at how we are fueling that motion. One of the nutrition journals we read stressed that her food intake has to track with her real activity level.
Yes, not just a general idea.
Right, not just this vague idea you have in your head of what a working breed is supposed to eat.
You have to feed the dog in front of you based on what she actually did that specific day or week.
Because rest days and huge active days in the field might call for entirely different caloric intakes.
Exactly. And remember, those high-value training treats, they count toward that daily total.
Oh, yeah. Table scraps quietly add up.
They really do. You can undo a brilliant, scientifically backed nutritional plan just by being a little too generous during family dinner.
So true. Okay, so if you're putting all that tailored fuel into the engine, the sources next point to how you are actually running that engine.
The exercise rhythm.
Yes, that concept comes up a lot.
What's fascinating here is that the rhythm matters just as much as the volume of the exercise itself.
Interesting.
Her body requires consistent movement paired with mental work. What you want to avoid at all costs is the weekend warrior pattern.
The weekend warrior. That paints such a clear picture.
It really does.
It's like a human who sits hunched over a keyboard at a desk, completely sedentary Monday through Friday, and then suddenly decides to go run a half marathon on Saturday morning.
Yep.
It is a guaranteed recipe for pulling a hamstring, waking up with extreme stiffness, and limping around the office on Monday.
That is the exact physiological response that happens to the dog.
Wow.
Packing all of a GSP's intense exercise into one massive weekend outing after a week of doing nothing, it doesn't lower her risk of injury, it actively raises it.
Because her muscles just aren't prepared to fire for that long.
Right. Her joints don't have the necessary synovial fluid flowing to handle that level of stress, and her stamina isn't calibrated.
Makes total sense.
And this brings us to a crucial piece of preventative care from the sports medicine journals that people almost always skip.
The recovery data.
Yes, recovery day.
Meaning analyzing how she acts the day after the big run.
Yes. Preventive care isn't just about the work the GSP does. It's about how her body handles the inflammation after the work.
Okay, so what are we looking for?
If you notice stiffness, limping, reduced enthusiasm for her morning walk, irritability, or a drop in appetite the day after a big activity.
That's the vital recovery data.
Exactly. It tells you objectively that her exercise rhythm is off, or that she pushed past her physical limits.
Because a GSP doesn't just trot nicely on a smooth, climate-controlled treadmill. She is pushing that physical engine through heavy brush, over rocky fields, and into muddy, unpredictable lakes.
Oh, yeah. They go hard.
Which means the outside world is inevitably going to hitchhike back home with her. This takes us directly to the post-adventure inspection.
The outdoors check.
Right, the outdoors check we saw detailed in the field trial guides. Here's where it gets really interesting. I want to start with the paws, because reading about paw mechanics blew my mind.
It's fascinating.
For GSP, paws aren't just feet. They are the literal contact point between the dog's massive internal drive and the incredibly rough terrain she loves to conquer.
They take an immense amount of punishment.
Yeah.
After a hike, a run, or serious field time, you need to be checking those pads meticulously. You are looking for pad cuts, worn or cracked pads from rough surfaces, and foreign objects.
Like grass seeds or small thorns stuck deep between the toes.
Yes. An altered gait is often the very first sign of a paw issue, and you want to catch that before it changes the way she carries her weight.
And speaking of carrying weight, I was reading about nail trims in one of the orthopedic journals, and it completely changed my perspective.
Oh, the nail mechanics.
Yeah. Even if the nails aren't torn, just having them be slightly too long is a major structural problem.
A significant problem. The mechanics are wild. When a dog's nail gets too long, it touches the hard ground and pushes back up into the toe joint.
Right.
This literally sends a signal to the dog's brain that they are standing on an incline.
That is crazy.
It throws off her traction, changes how her foot strikes the ground, and forces her to shift her weight backward, which alters her entire posture and movement.
And over time, that causes joint pain up the leg, right?
Exactly. So regular trims matter far beyond just making her paws look tidy on the living room rug. It is a structural necessity to keep her joints aligned.
See, that is the exact kind of detail that makes this deep dive so important. But we also need to talk about ears and coat.
Yes, definitely.
Because the GSP is famous for loving water, and she has this short, sleek, beautiful coat. My initial thought was that grooming and post-swim care would be pretty hands-off.
You'd think so, wouldn't you?
Yeah, you just towel her off and you're done, right?
I have to correct that assumption because the anatomy of a dog's ear works against them here.
How so?
Water might satisfy the GSP's body and her drive, but those ears absolutely require an owner's attention afterward. Because they hang down, they act like a heavy flap that traps moisture inside an L-shaped ear canal.
Oh, and yeast and bacteria just thrive in warm, dark, moist environments.
Exactly. After every single swim, you must check her ears. You are watching for head shaking, scratching, an unusual odor, redness, discharge, or if she's sensitive when you touch around the base of the ear.
And if an ear does look red or smells slightly funky, the veterinary sources are adamant that we shouldn't just be reaching for whatever random eardrops we have left over in the medicine cabinet.
Definitely not. You cannot guess what is growing in there. Reaching for random products can actually cause deafness if the eardrum is compromised, or you might be treating a fungal infection with an antibacterial drop, which does absolutely nothing.
So that requires a vet visit to look under a microscope.
It really does. Now, as for the skin, you are right that the short coat works in your favor. It makes finding ticks, fleas, insect bites, and contact irritations much easier to see than on a heavy-coated breed.
That's a relief.
But, and this is a critical distinction made in the literature, easier to see doesn't automatically explain the cause.
Oh, right.
You still have to investigate whether it's seasonal allergens, environmental irritants, or parasites.
And since we're checking the head, the field guides emphasize looking at the eyes, because a GSP is moving nose first through tall grass and dense brush constantly.
Always nose first.
Yeah, every twig, seed, and blade of grass is whipping past her face at high speeds. So you're looking for redness, squinting, discharge, cloudiness, or if she's actively rubbing at her eye with her paw.
Because the journals agree that eyes are one area where you never take a wait-and-see approach.
Never.
Exactly. Eye injuries, like corneal scratches from a branch, can degrade and become infected very rapidly.
Scary stuff.
It is. Now, while we are doing this post-adventure check to catch all the external wear and tear, the sources also focus heavily on the biggest threats to a GSP being internal or environmental.
Threats that are driven by her sheer, unstoppable enthusiasm.
Yes.
Like her teeth. Dental care is one of those things that seems so easy to push off, especially in a young, wildly enthusiastic dog.
People put it off all the time.
You think, oh, she's young, her teeth are fine, we'll worry about professional cleanings when she's a senior. But a mouth that enthusiastically retrieves dummies, chews on hard sticks, and trains hard needs preventive care right now.
Right now.
The dental guides tell us to watch for tartar buildup, red gums, noticing if she's carefully chewing her kibble on only one side of her mouth, or if she's suddenly dropping food out of her bowl.
Those are signs of pain. That enthusiastic retrieve relies entirely on a pain-free mouth.
Makes sense.
Dogs are masters at hiding dental pain, so you have to look for those subtle mechanical shifts in how they eat.
Okay, what about the other internal hazards?
Well, Moving to another internal hazard, and I want to emphasize this because the veterinary literature highlights it as a massive breed-specific threat. We have to talk about bloat.
Okay, this sounds terrifying. Every source on large breeds mentions it, but what actually is it?
The medical term is gastric dilatation volvulus, or GDV. It is an absolute medical emergency.
Okay.
Because the German Shorthaired Pointer has a very deep, narrow chest cavity, their stomach is suspended a bit like a hammock. In bloat, the stomach fills with gas and expands rapidly.
Oh, wait.
And because of that deep chest space, the stomach can actually flip or twist on itself.
Twist?
Yes. When it twists, it traps the gas and completely cuts off the blood supply to the stomach and sometimes the spleen.
That explains one of the main symptoms the sources list, unproductive retching. The dog is trying to vomit, but nothing can get past the twist in the stomach.
Exactly. The warning signs are crucial. Unproductive retching, a visibly swollen or rigid, painful abdomen, visible pacing, and severe distress.
And drooling, right?
Yes, excessive drooling, weakness, or collapse. The goal here isn't to create daily anxiety every time your dog eats a meal. It is about background preparedness.
And if you see that specific combination of signs,
You do not wait. You don't see how she feels in an hour or try to give her antacids. Tissue is dying by the minute.
you go straight to emergency veterinary care.
Straight there. Knowing where your nearest 24-hour emergency clinic is before you ever need it is a critical, non-negotiable part of owning a deep-chested breed.
That is a massive internal hazard. But reading further into the field training manuals, her enthusiasm creates environmental hazards too.
Oh, absolutely.
A GSP will often run until she drops if you let her. Her drive to work is literally louder than her own physical discomfort. The sources call the solution weather planning. As the owner, you have to listen to the weather before the dog does.
This raises an important question of responsibility. Dogs do not sweat like humans. They only release heat through their paw pads and through panting.
Right.
In the heat and humidity, they simply cannot cool down an overheated engine fast enough. You must plan exercise during the cooler morning or evening hours.
And bring plenty of water.
Yes, and actively avoid hot pavement that will literally fry those delicate paw pads. And watch for excessive panting that won't settle down. You have to act as the brakes because she won't.
But the manuals also point out the flip side of weather planning. That short coat we love is very honest about the cold, the wind, and the rain.
It is.
She is a tough, rugged dog. She isn't fragile, but she doesn't have a thick undercoat to trap heat.
Exactly.
If she's running through a snowy field, she's generating plenty of heat. But if she's just standing around wet and inactive in the middle of winter, that short coat isn't going to protect her core temperature.
That's a vital distinction. It's entirely about context and activity level. So we've talked extensively about protecting her physical body from the terrain, from her own drive, and from the weather.
Yeah.
But protecting the dog is equally about managing her mind and her environment.
And this is the part of our research that flipped my perspective completely. So what does this all mean? How does obedience training, like teaching a sit, a stay, or a recall, actually fit into medical preventive care?
It's a great question.
Because usually we separate those two things entirely in our minds. Training is for good manners, and the vet is for medical care. But the sources treat training as a medical intervention.
They are deeply intertwined in an adult GSP. Training isn't just about impressing your friends with a polite dog. It is injury prevention, emergency prevention, and freedom management.
It's like an invisible safety net. If you have rock-solid off-leash training, a perfect recall, excellent leash manners, a solid weight command, you are literally building an invisible armor around her.
Beautifully said.
That weight command controls her before she jumps into rushing unsafe river currents. The recall protects her from running blindly into traffic or having a dangerous encounter with a venomous snake or aggressive wildlife. Her obedience is literally keeping her out of the surgical suite.
It is the ultimate preventive medicine. And the training manuals stress that off-leash reliability isn't a set-it-and-forget-it skill. You can't just assume it will always be there because she was good at it last month.
Right. It requires active daily maintaining.
Furthermore, behavior itself is often the very first medical warning sign you'll get. Before her body gives you a clear physical symptom like a pronounced limp or a high fever, her behavior will shift.
Which brings us right back to the baseline. If her baseline is to be at the door, bouncing and ready to go at 6 a.m., and suddenly she's quiet, hiding in a corner, and doesn't want to get off the bed.
That is a medical symptom.
Wow.
Sudden quietness, unusual clinginess to you, refusing a run she would normally jump at, resisting being handled when you touch her back, or new irritability and trouble settling down.
Because dogs instinctively hide pain.
Exactly. If you see a real behavioral shift from her normal, it is worth noting and bringing up to your vet.
Got it.
And while we are talking about managing her environment, the medical guidelines are very clear about vaccines and parasite prevention. These cannot be standard packages. They must be tailored specifically to her individual lifestyle.
Because a GSP who spends every weekend plunging into swampy woods, retrieving ducks, and boarding at a busy kennel has a massively different risk profile than a GSP who mostly jogs on paved suburban trails.
Precisely. It requires a nuanced conversation with your vet based on regional risks, tick populations, how much time she spends drinking from streams, and her travel habits.
Her world is big, so her prevention has to travel with her.
Yes.
That means ensuring secure fencing at home, using crash-tested car restraint systems for all those trips to the trails, ensuring heat safety in vehicles, and knowing where the emergency vet is located wherever you happen to be traveling.
Well said.
We have covered a massive amount of ground today. And there is one overarching habit mentioned in the owner case studies that ties this entire deep dive together.
The tracking.
Yes, the ultimate tool for maintaining the athlete. Tracking. You need to track all these details we've discussed. Her weight, her body condition score, her exercise volume, the recovery data, the results of your paw and ear checks, dental notes, behavior shifts, when her vaccines were given, all of it.
It's so important.
One of the sources actually profiled owners using an app called VitalPet to keep all these health records and daily care routines organized in one place, so you aren't just relying on your memory when you walk into the vet's office.
Because human memory is notoriously unreliable, especially when you are stressed or worried about your dog. You might think a limp started on Tuesday, but data might show she was actually slowing down the previous Friday. Tracking provides objective data to your veterinary team.
Okay, let's recap the adult routine we've extracted from these sources today. It starts with intimately knowing her normal baseline, every sound and habit of the engine. It involves running meticulous, hands-on post-adventure checks on her paws, ears, eyes, and body. It requires maintaining her training as an invisible safety net, actively planning for the weather to protect her from her own unstoppable drive, and systematically tracking her behavior and physical condition.
Spot on. And we need to firmly reiterate the urgency triggers from the medical journals. Knowing her baseline is fantastic, but you must know when not to wait and see.
Right.
If you suspect signs of bloat, if she collapses, has any difficulty breathing, shows heat distress that won't resolve with immediate cooling, has persistent limping, repeated vomiting or diarrhea, refuses to eat, or displays any sudden severe behavior change, those demand an immediate call to your veterinarian.
That is not the time to monitor and track data.
No, that is the time to act.
Absolutely. And I want to leave you with a final lingering thought to mull over as we close out. All this adult maintenance we've been talking about from these sources, the careful checks, the tracking apps, the managed exercise rhythms, it isn't just about keeping her healthy today.
It's really not.
It is the vital, unavoidable preparation for what comes later. The daily habits and the tracking baseline you establish right now, today, will dictate her mobility, her dental comfort, and her muscle retention in her senior years. You are building the foundation for her future right now.
That's incredibly well put.
So I'll challenge you with this. How precisely do you know your own dog's normal right now? If her baseline shifted by just 10% tomorrow, a 10% slower recovery, a 10% change in appetite, would your tracking habits actually be sharp enough to catch it before it became a full-blown crisis in her senior years?
That 10% shift is the real hidden test of preventive care.
It really is. Think back to that perfect day we pictured at the start of our discussion. To keep those evening snuggles happy and pain-free for years to come, you've got to put your hands on the dog and do the work after the run. Thank you so much for joining us on this deep dive into the world of the German Shorthaired Pointer. We'll catch you next time.